Good morning, folks. Wish I could see your faces. We like to interact face to face, but due to COVID situations, we have to go for this online classes. There is no other option. Let me put my words as a physician. I always think like doctors as a chosen one. I consider myself as a chosen one. The thing is, so many doctors have come in contact with, they have this compassion, they have a patience, and they have a empathy, and they have sympathy towards the suffering and all. So the God will selectively select only those people with that frequency, and they are put into this profession, I believe. Okay. So I don't know whether you guys are into profession by choice or by chance, or you have been pushed, or it's a destiny. But believe me, it's a wonderful profession. They say Vaidyo Narayano Hari. Our place is next to the God. They say God gives life, the doctor saves life. So we are almost on par with the God. Okay. So consider yourself as a superhero. Whenever my day starts, I put a apron and I put this step and I enter the hospital. I have this feeling that I am being a chosen one, and I have been given this privilege by a society to attain this post, and it's time for me to give back to that society, do some service to the society. Okay. And coming to statistics also, the recent statistics say that the doctor to population ratio is 1.34 is to 1000 population. So you are the chosen one among the 1000 population. So consider yourself as a superheroes. Okay. And coming to this human body, this is the most sophisticated, intricate, the supercomputer the God has built. Okay. The scientists are trying to build all this AI, artificial intelligence, and the supercomputers and all. But think of this human body; it is so delicately, so nicely balanced to the level of atoms, enzymes, molecules, feedback reactions, neurons, circuit. Everything is so nicely built. You guys agree with me, right? This is a super sophisticated computer, our body. Do you agree? Yeah, thank you. So, to study this human body, we need a user manual. So, you guys will be studying this user manual for another 5 years in your MBBS. Okay. So, once you are into this profession, you have to dedicate your time, almost a decade of your time, the 10 years of your life will be kept aside only for the study. You have to give that dedication, commitment, you have to sacrifice a lot, guys. You have to sacrifice all the family, function, get together, festivals and all. You have to dedicate yourself, you should have the patience. Only then you will be given the title of doctor by a registered medical council. You will be given that registered practitioner by Medical Council of India. Okay. Coming to the responsibilities of the doctor. So doctor plays a many role. As sir told previously, Dr. Narayan Murthy sir, doctor plays a many role. He will act as a medical expert. First, he is a master in his field, so he is a medical expert. He is a good communicator. He is a good registrar. He has to keep the record of everything, even the case sheets, investigation, medical legal section, everything. He has to keep the record of that one. He has to be a good manager. He has to be a leader, because he will have a team, both pre and para, sisters, Aya, nursing, everybody will be there, hospital management and all. He should be a good manager. Then he should be a good leader. He will have a team of doctors. Sometimes we will have PGs or interns. We will be a leader for the team. Then we act as a health advocate also. We act as a counselors. We act as a health advocates, and finally we act as teachers. So we have learned. We have come to this profession. Now this is the time for us to give back. We have to train the students so that they will become experts in their field. So coming to the first role as a medical expert. So I sit in a hospital, I am the medical expert. As soon as a patient enters, enters the hospital or nursing home or wherever the room you are sitting, okay, as soon as the patient enters, there is a special bonding between the doctor and the patient. It is a unique kind of bond where the patient will trust you. He trusts his life with you. He trusts his life of the kith and kin with you. He respects your decision. So here patient comes to you with some suffering. It could be physical or physiological or mental or psychological. So patient has some discomfort or patient has some suffering. So he has come to you with a belief that you are going to heal his suffering. So there is this special bond, that is doctor-patient relationship, that is a unique bond. Okay, that is the very much basis of the trust. Patient will gain the trust. You should be trustworthy. Patient trust will begin with that bonding, and that doctor-patient bonding is very much important for the care of the patient, for the smooth healing of the patient, and for the good outcome. Okay, so that is the very much basis. We say faith. Whenever the patient has the faith on the doctor, he is going to believe that this doctor is good, he is going to heal my ailments. The 50% of the disease is cured. The next 50% is taken care by the medicine. They say it is Kaiguna. Doctor Kaiguna tumba chanagide. Once they believe that you are going to be a good doctor, so that faith is very much important for the healing process. Okay. So, whenever you talk to the patient, pay respect to the patient. The learning the medicine without seeing a patient is like learning the swimming without getting into the water. You may read the manual, like you have to hold the breath and you have to float your body, you have to row your hands and legs and all. How much ever you read the manual, until unless you get into the water, you won't learn the technique of swimming. Just like that, until unless you see the patient, you examine the patient, you won't learn the medicine. So it is utmost important, if you want to learn the medicine, you have to respect the patient. Okay, patient through their suffering they are teaching you. So pay utmost respect for the patients, and please don't show any arrogance or attitude. Be humble to the patient, because they have come with some suffering. Even though through their suffering they are trying to teach you, so try to be humble as possible. Don't be arrogant or don't show attitude. Okay, na? Once you start that doctor-patient relationship, you are talking to the patient. Be an active listener. Okay, you get so many clues and so much of information about the patient by just being an active listener. You should have a patience and you should be a listener. Patient will be narrating his suffering. You don't do something on the mobile and you will be thinking of something or talking to something. Please don't do that. Should be active listener. You patient will gain the trust by seeing your interest. Patient will gain that confidence that yes, doctor is really interested in understanding my suffering, diagnosing my condition, in treating my condition. You can gain the trust of the patient by listening to the patient. First and foremost, if you want to become a good clinician, you have to listen to the patient. What symptoms started first? How it progressed? What are the associated symptoms? How it affected the quality of your life? By those symptoms only you can diagnose. 90% of the diseases can be diagnosed only by the history, by talking to the patient. Only the 10% can be diagnosed by all the investigation. So as soon as the patient comes to you, you are sitting in a consultation room. Patient comes and tells, I am having fever since 3 days. Don't write the investigation for fever workup. Send the patient. Patient comes and tells cough and send X-ray. Send for X-ray. Please don't do that one. If you want to gain the trust of the patient, if you want doctor-patient relationship to improve, that bonding to happen, please listen to the patient, active listening, and be patient and analyze the history. Even the simple of the clues in the patient's history will tell you what is the socio-economic background, what is the quality of the life, what is the cultural background of the patient. Everything you can assess just by listening to the patient. Just so be an active listener, be patient. Okay, you should have very good communication skills. In between, you can reassure the patient, you can educate the patient while taking the history also. Patient may come with a food poisoning, like patient went outside, he ate something and next day he comes with a food poisoning. So you can always address the patient, you can educate the patient saying that sanitation is important, hand washing is important, good water is important. A patient comes with a dengue or malaria, you can always say that how to control the mosquito bites, insect bite. If the patient comes with alcoholic patient comes with the cirrhosis or hematemesis, you can say that all these habits of yours, alcohol or cigarette smoking, has caused this disease. So you can educate the patient regarding the bad aspects of the habits. Okay, and you can always be open to the patient. Whatever you know through the history or through the examination of the patient, you can put that facts on the table in front of the patient, give all the option, whatever the option available. This is the diagnosis, this is the prognosis, these are the options available, this is the best option for you. Always include the patient in your treatment plan. We have different modes of doctor-patient relationship. Earlier in 1900, we had Parsons model, that is paternalism, where doctor is an autonomous body. Doctor is considered right always. Doctor is a deciding factor, where patient was only a passive one, whereas it went through a different changes. We have different models like first we have the Parson model, then we have consumerism, then we have submissive model. Now we have a mutual model where doctor will come up with his ideas and the facts, and the patient will come up with his ideas of the medical knowledge and his option and his financial background and everything. Finally, all the opinions are put on the table and they will choose the best option that is acceptable for the patient with his financial background. So always be open to the patient, communicate with the patient. So many problems are happening and so many lawsuits have been filed against the doctors and the hospital because of this miscommunication only. Whatever you want, first gain the trust of the patient, be open, take the responsibility, be open to the patient, discuss the facts, what is happening the patient, whether he is improving or whether he is deteriorating, what is happening, what are the newer modalities of treatment, anything extra to be done, and what are the best options available to lessen the suffering of the patient. Everything you need to communicate with the patient or patient attenders. Be open, be good communicator. The communication skill is very much important as a part of physician. Okay. Then meanwhile, always while you should be a good listener and you elicited the history, always make it a point to examine the patient. The touch, healing touch of the doctor is very much important. Just touch the patient to know his temperature, know his pulse, or just put your steth and see what is happening to his respiratory system or cardiac system. There is some problem. Until unless you touch or examine the patient, patient won't gain that trust. They feel that doctor is in hurry, he didn't examine me completely. So give your time and space, let them narrate their history, talk to them, be patient, communicate, then examine the patient and come to the treatment plan and discuss with the patient attenders what is the best for the patient. Okay. And while doing that one, you can also explain the limitation. Sometimes patient may come with, like patient has come with acute cardiac arrest or acute heart attack. So you are a physician, you want a cardiologist, you can't do angiography or bypass surgery. You can refer the patient to IR center where cardiologist is available. Some patient has come with a head injury, patient is having massive subdural hematoma, needs extraction. Patient needs a neurosurgery reference. You don't have neurosurgery at your hospital, you can always refer to the IR center. Be clear about the limitations of your hospital so that there won't be any problem in the future. Okay. And at foremost important thing is privacy and confidentiality, because the patient will be telling so many sensitive information about his family or his work or his health and all. You have to be you have to give utmost respect and importance to his confidentiality. Don't do or loose talks in front of the patient or the attenders or other colleagues about the patient issues. That is not a good thing. And while examining the patient, don't ever go by any bias, no bias, okay, no gender bias or patient's social background, educational background, ethnic background, he is from the different religion, he is from a different state, doesn't matter. Do your duty, no bias. Okay, fine. And always keep keep yourself updated, because the medical knowledge is so versatile. Earlier in 1900s, it used to take 50 years for the medical knowledge to double. Now in 2020, 2000, it is like every 5 years the medical knowledge is doubling. So it is not like 10 years I finished my MBBS and MD, I finished my studying, doesn't happen. The newer treatment part and the newer investigation, everything, the newer molecular technology, like RT-PCR, or there are so many tests going on, so many newer molecules have come into the market, and there is a radical change in the treatment of the so many diseases like connective tissue disorders, cancers and all. So many incurable diseases in the earlier phase are curable nowadays. Life can be prolonged to 10-20 years even with so many type of blood cancers and sarcomas and all. So they have many newer treatment options available. So keep yourself updated. And in this digital world, as soon as you say the diagnosis, patient is having blood cancer, even the patient attender will come with, yes madam, this is a blood cancer, these are the option available, do you have this option in our hospital anta keltare. You should be updated. You should not blabber in front of the patient. Yes, we know these are the options, but that may not be available. If it is available, you can treat the patient. If it is not available, you can refer the patient to cancer specialist. Okay, and you should be a lifelong learner. There is no other option. You should communicate. You can exchange your ideas with the colleagues of your same department, or you can go to the conferences where you can communicate with the super specialty doctors. You can update your knowledge. Okay, fine. Every day, at the end of the day, at least you should feel that morally, ethically, you are done justice to your job. Okay, you should have that sense of satisfaction at the end of the day. Yes, sir, sure.
Okay. Good morning, madam.
Good morning, sir.
Thank you for joining us. So, restricting ourselves to this particular topic of being responsible and being trustworthy. Let's say I have a patient who is a hypertensive.
Yes, sir.
I have recently, on his first visit, I check his BP and his BP is like 200 by 110. And I diagnose it as hypertension on first visit itself, and then start him on some treatment. Can you like expand on how important is that developing a response? I mean, showing that you are going to be responsible for that patient, and also be trustworthy, and showing that trustworthiness to the patient is important in that relationship between the patient and you.
Okay, sir. Certain diseases like diabetic, hypertension, heart disease, and chronic kidney disease, chronic heart disease, and all, they are very much chronic. Most of the patients are going to have those diseases for lifelong. So, once you say the diagnosis that you are a diabetic or you are a hypertensive, patient will have that apprehension that I have to take the medicine lifelong. First, you should gain the confidence of the patient. You just like breaking the bad news, you saw the other video, just prepare the patient. What is his, first ask about what is his knowledge about the hypertension or diabetes. Does he have any knowledge? What are the side effects or any long-term complications of hypertension? Any knowledge about the hypertension? Does the patient has any background knowledge of the hypertension? You need to talk to him and make sure that you will be there with him for the whole control of the diabetes or control of the hypertension, and you need to gain the trust of the patient, saying that patient is already diagnosed with the hypertension or stage 2 or stage 3 hypertension. Patient might have developed underlying complication also. He may need further workup. Just make sure that you will be there with him for the control of the diabetes, control of the hypertension, and in preventing the further complication. And at the same time, explaining the patient about the dietary modification, lifestyle modification, other modification that can be done to control the hypertension.
So you are essentially saying that uh, we need to explain everything and talk to them and advise them not just about the disease itself, about everything, every aspect of the disease, and what what you are going to offer to the patient. Yeah, probably make a plan,
Yes.
like how often the patient should visit. That way, you're making a commitment from your end that you are going to be responsible. That whenever he comes for that follow up, you're going to be there
You
to
will be available.
examine and
Yes.
see and follow up with him. So that is a commitment you are making towards the patient. That conveys that you are a responsible doctor.
Yes. Sir.
So, and you're also making a detailed uh, plan to the patient and saying what all they can change in their life, modify in their life, so that probably, I mean, they think, why is this doctor telling me all these things? They will reflect on that and they will realize it is in their best interest. So, if a doctor is actually seeming to be looking out for you, that is, the doctor is trying to give you information that will help you make better choices, then they will probably be trusting of you. They think, yeah, this doctor is not greedy, he is not money minded. This doctor really wants to help me,
Really genuinely
genuinely
interested
wants
in
to
the.
help me and take care of me. So, this doctor is a trustworthy doctor.
Yes. Sir.
So, I think this way we can. This is just a small
Just
example
one
which
example. Yes. Sir.
I said. But can you? I mean, we also saw those two videos. In the first video, we saw that there was a nurse who was taking care of a head injury patient, and the doctor who was supposed to be in charge of that nurse, I mean the patient, is a neurosurgeon, and as the other nurse who hands over the patient details to the new nurse who is taking over, she says to her, like, this is Dr. Smart's patient. So the
She
way she
gives a
said
hint.
it made me wonder, oh, there must be a reason why she is saying that. That means this doctor is not a trustworthy
Trustworthy.
doctor, and
Yes.
he's not a responsible doctor as well. Because
Something can
when
go
yeah,
wrong and
the
he may
way
not be
she
available.
the way she actually handed over the patient details and said, beware of the Dr. Smart, because the Dr. Smart can be a handful. She even warned her. And as the video, as we saw the video unfold, we realized that yeah, this Dr. Smart is a very smart ass and who thinks too highly of himself, and he's not even though the patient is admitted under him, and information was transferred to him or given to him about the condition of the patient, he didn't bother to actually take that responsibility on himself,
Yes.
or be or change his attitude towards the nurse and inspire some confidence in her, saying that yeah, you can do this, do that, I will reach there, meanwhile you do this or something. He didn't take her into confidence, he didn't win her trust. So this is that I think that video was a very good example of how not to be a complete douchebag,
Yes.
you
Sir.
know, as a
Actually, it's
doctor.
yes.
So that's what I could understand from that video. Watching that video with the students, I felt that was a very good example of how not to be disrespectful of your colleagues and your
Yes.
healthcare team, and also how to win their trust and how to keep them in confidence so that they feel confident in approaching you and trust you to make the right decision and be responsible. So, do you want to add anything to
Yes, sir.
regarding
Same.
that video, madam?
Yes, sir. Same thing. Actually, in that video, I could see that sister was trying so much, and she had that previous experience with the same Dr. Smart 1 week back, where she had this similar experience, like how he was a douchebag and all. And the next time she thought, if something goes wrong, I'll be in trouble. I won't be able to face him, and she'll have that mindset. On top of that, even the doctor is so egoistic and disrespectful for the nurse. When she calls up and she tells, "You are not even capable of doing this one. What can I do?" It is his responsibility. Patient is admitted under him. He is a senior consultant. He is supposed to look after that too. Whenever patient is in ICU, it is a responsibility of the duty doctor to observe, watch for the patient every hour. There's something, vitals may change, patient may deteriorate. Some intervention could have been done meanwhile, because the nurse was constantly coming and asking even the resident. She was asking to call up the consultant. Nobody turned up to see what has happened, and nobody intervened. What could have been, at least they could have given the instruction to sister saying, at least get this investigation done, or start these inotropes, or give the fluids, or give some antibiotic. Nothing, no instruction was given. And this it the tone with which that a consultant was talking to the sister, it was like very authoritative, and it is very like scolding type. uh, and the way he managed the patient was the example how we are not supposed to be in the hospital. Whenever any patient is admitted under your care, it is your responsibility to what is happening to your team, and you should have confidence of your full team. Even it may be a group D, or it could be a sister, staff nurse, or junior. You should have the confidence of your entire team in managing any case, and you should be clearly updated about what is happening to the patient. If anything happens, if the patient is deteriorating, what should have been done? Clearly, instruction should have been given. Even when the sister calls in the night 1 o'clock saying that patient is deteriorating, BP is 90/50, he didn't give any instruction to the sister at least to start something. I'll be on the way, I'll reach. That was very, that is how the patient attenders they, I think they file lawsuits against the doctor saying that they are negligent, and there was misconduct, and they suffer, patients
Yeah, I
suffer.
think as even though I'm a doctor, I do feel that kind of attitude and that kind of a responsibility does amount to be negligent.
Yes,
So
it is, can be negligence.
their patient has every right, and they are in the they have the right to sue the doctor and
Yes,
actually
they
get.
can go to the
Yeah,
consumer court.
It's not. Yeah. See, just because that doctor was irresponsible, a patient died, and that's how important these things are. Like being irresponsible can actually lead to death. That is why it is so important that you be a responsible person.
Yes.
It is not just about being responsible just to your patients. This should become an attitude in your entire life.
Yes.
So you be responsible in everything that you do. That way, that carries over to your practice as well, so that you don't kill patients due to your irresponsible nature.
Yes, folks, that is a very good message. In our profession, we are dealing with the live patients. If something goes wrong, it is not like a computer or not a project or something else where you can redo or rethink or replan or start over. But here in medical field, you are dealing with a live subject. Even your act or your omission of act, if you are doing something at the time which is supposed to do, or if you are not done something which is supposed to do, even it can amount to the suffering or the discomfort or loss of life. If once you lose the life, nothing can be done to retrieve that back. So always be responsible, take a call, and be responsible, and try to give justice to your profession. So regarding the second video, sir, anything you want to say?
The second video, yeah, I had some inputs. So that shows a good example of how to be a responsible person. So we saw that in the second video, the doctor was repeatedly saying that I will be there. I am there for you. Me and my clinic is always available for you to take care of you during any kind of whatever emergency you
Giving
have.
so
Or
much of confidence to the
yeah,
patient
so
that we will be there. Yes.
when you reiterate that you're going to be there for the patient, that instills that confidence in the person, the patient, that this doctor is a responsible doctor. And to prove that she is a responsible doctor, she gave all the contact details and made sure that she has arranged the meetings with the next medical
Consultant.
oncologist. So she is not only just saying the words of being responsible, she is also
Showing.
enacting it and doing what needs to be done as a responsible doctor. She scheduled an appointment with a medical oncologist so that the patient can actually go to the next consultant and get the proper medical management done. And also, she made sure that now nobody interrupts her during that
Yeah, the
in
first point she tells,
discussion
yes,
with
sir.
the patient. You know, she left her mobile and pager, everything with the nurse, and she came with to the patient and she introduced herself and made sure that nothing is going to interfere in what we are discussing right now. So I'm very, quite serious about this and I'm responsible. So I'm conveying that to you of that I am responsible by doing this.
Yes.
So these are all kinds of non-verbal ways of uh, showing to the other person or your patient that you are a responsible person.
Yes.
It's not just like, yeah, I'll come here and I'll just say I'm going to be responsible. But you have to
Yes, we have to show.
actually do it, that you are going to be responsible.
Yes.
You are responsible. So you have to show that. So
Yes.
how you show that is by your actions. So I think now shall we open this to the students,
Yes,
and if they
in
have
in our
questions.
profession, just last one word, sir.
Yeah.
In our profession, we don't have a job like 9 to 5. My duty is done. I'm gone. Because it is 24 bar 7, you are responsible for the patient. You have admitted a patient in ICU. Suddenly, patient starts worsening in night 8 o'clock. It is your responsibility. You have to make sure that patient is attended. Either you have to go in person and attend, or you have to talk to the team or the resident or the nurse or PG, whoever is over there. They have to make sure that patient is attended. What is going on, that is been attended, or the treatment, the proper treatment has been started. In our profession you should have a lot of compassion and lot of patience. It is not like my duty is over, I'm going. It doesn't happen like that. You are responsible for your patients 24 bar 7 whole life. It will be like that only. The other day, just Friday, I finished my duty at 5 o'clock and I was about to leave for home. 5:30 some patient came. He came traveling 50 kilometers. I mean, he came from the 50 kilometers. He just wanted to talk to me about uncontrolled diabetic state. My duty was over. I could have just said him no, I want to go. But you have to respect the patient because he has come so far asking for you. All they ask is 10 to 15 minutes of your time. You can't say just my duty is over and you can get off. You can just go like that. You have to give that extra time and the compassion, and you should be responsible. All they ask is 10 to 15 minutes of your time. Just sit back, talk to them. Even if you just see them once, listen to them, touch them once, they will be happy. They feel happy that yes, our doctor has seen us. You want to give that trust. You should build that doctor patient relationship, and always uh, respect patient decisions. It may not be good for you. It happens. Even last month we had a patient. He's a retired college professor. A patient came with a headache and there was a right upper limb weakness. We got MRI done and it was showing grade 4 brain tumor, glioblastoma multiforme. And with all the modalities of treatment, surgery, chemo, radio, the prognosis is only 10 to 12 months. We advised him all the plans available. Sir, you are in this stage of the tumor. You need to consult a neurosurgeon and oncologist. You need to go for this further intervention. But the professor clearly denied. No, ma'am, I don't want anything. I don't want the suffering. I just want to stay calm. I have enjoyed everything in my life. Let me go peacefully. I don't want all those suffering and the intervention. They will cut open my brain. I have to be dependent on the family. I don't want all those things. Just respect my opinion. I I don't want anything, and just give me some painkillers. He comes now and then, every once a week or once in 10 days he comes back. He may complain of weakness, you want some multivitamins or painkillers, he goes up. You have to respect the patient decisions. Keep all the option open. Let them decide what is best for them. Don't ever always just put enforce your decisions. Always be open in communication, respect their decision, and do the justice to the job.
Yeah,
Is there any-
if the students have any questions or any comments to make about what they felt about those videos in respect to responsibility and trust, you are more than welcome. Please go ahead and ask Madam any questions you have.
Hello, you folks are there?
I see 77 people attending it, but nobody is talking. So,
Did we made you to sleep? Any questions regarding the responsibilities of the doctor? Yes. Huh. Since 1995, to the my knowledge, the medical profession has come under Consumer Protection Act. It's not. It has been removed. Okay, let me check with the medical legal team. We have a separate class on medical legal classes, how to maintain the medical legal cases and how to maintain the records, and about the law issues that will be discussed by another consultant from the forensic department. Maybe I am not aware of being removed from that one. I was still thinking it is under Consumer Protection Act. But from your side, if you are responsible in talking to the patient and maintaining the records, and you have done a good job in the best interest of the patient, you have given the proper treatment with the proper communication, not holding back any information, I don't think that is going to be any problem in managing the cases.
Okay, ma'am. Thank you.
Thank you.
any other question? If any of you have any questions for Madam, please do ask uh, loudly into the mic so that we can actually hear, everybody can hear it. Okay, in that case, you can carry on and fill the feedback, which will be posted very soon.
Thank you, guys. Hope to see you soon. And thank you, the organizers of the foundation course. Thank you, one and all.